Good morning. My name is Anita Mogaka, and I serve as the Marketing and Communication Specialist at the Greater Milwaukee Foundation and a proud member of the newly created Stronger Together Collective. We are thrilled that you've joined us this morning for the launch of the Stronger Together Collective and the official You Matter campaign. What started off as a need identified by a group of African American leaders turned quickly into the Stronger Together Collective, a diverse group of Milwaukee community leaders who have taken this important step to ensure that communities of color have the resources that they need to stay inspired and hopeful during this current pandemic. With that, we'd like to thank the Greater Milwaukee Foundation for their role and support as a catalytic funding and collaborative partner. So without needing to explain, we are all aware that the pandemic continues to reveal the institutional and systemic racism that has persisted in Milwaukee and our country. Recent murders and attacks on the lives of Black men and women continue to occur, most recently right in my hometown of Minneapolis. Now more than ever, a campaign such as You Matter is desperately needed, not just as a fun or cool phrase, but as a movement to affirm exactly who we are in this moment and to collaboratively build on existing assets to finally create a new narrative for Milwaukee. So this event and community conversation officially begins our public awareness activities in Milwaukee's communities of color. From this point forward, you will begin seeing You Matter campaign messaging and visuals throughout the city on billboards and advertising, on social media, and so much more. So at this time, I have the pleasure and the honor of introducing Mayor Tom Barrett to give a few remarks.
Thank you very much, Anita, and thank you for your involvement in this. And I want to thank everyone who came together and brought this to our attention here at the city. And I know Commissioner Kowalik has taken this very, very seriously. And to me, this is community at its best, because this is clearly an effort that is led by community members, community leaders who understand the importance of making sure that everyone matters. And you are absolutely correct when you talk about the timeliness of this. Anybody who lives in America in the last 48 hours saw what happened in Minneapolis and saw what happened in Central Park in New York. And had to be appalled by both of those. So here we are in the midst of a pandemic that has huge, huge impacts on the African American community, on the Latinx community, on our elderly. And it is more important than ever that we put a spotlight on the issues that these communities face. But more importantly than putting a spotlight on it is having a long-term systematic impact to improve the living conditions for people in our community. And so I just wanted to, and the community matters. And I believe that the more we come together as a community, the stronger we are. So again, I want to thank you all for being here this morning. We've got a lot of work to do, but if we work together and let people know that they matter, that you matter, we'll be a stronger Milwaukee. Thank you, and back to you.
Thank you so much, Mayor. And at this time, I would love to introduce another member of the Stronger Together Collective, Nancy Hernandez, to share more about our purpose of the movement as we are starting.
Thank you, Anita, and thank you so much for those of you who are listening and our panelists who will be talking today. The Stronger Together Collective is really a group of Milwaukeeans who recognize the challenges of our communities of color and the frustrations that continue to add to the disparity in our communities. We have come together and taken an important step towards ensuring that communities stay inspired, informed, and hopeful as they continue to be negatively impacted by the current pandemic. Our unique approach, bringing Black and Brown people together, is providing much needed information and relevant solutions to our collective challenges. We are united in tackling the issues and committed to sustaining advocacy for our communities into the future. The You Matter campaign strives to let members of the African American and Hispanic communities know we are in this together, and together we can do our part to curb the devastating effects of our current health crisis and what it's having particularly in our communities of color. We are encouraging everyone to join us to express that communities of color matter today, tomorrow, and always. You matter. And that is why Cuídate, or care for yourself, is such an important and relevant message for us all. It's time to start our conversation. And to kick us off, I would like to introduce Dr. Jeanette Kowalik, Commissioner of Health for the City of Milwaukee. Thank you for joining us, Dr. Kowalik.
Good morning, everyone. This is a very important day. I remember the first meeting at the beginning of April, where there were a number of frustrations and concerns expressed from our community about the need to have more pointed outreach, more consistent outreach, to be more innovative in our approach. And I was very pleased that the group came together because as a health department, we were so immersed in the response. Again, our first case was on March 13th, and things had moved forward so quickly with how COVID-19 had manifested in our community, with that first hotspot being on the north side. So the need to educate others in our community that were at risk by where they live, where they work, if they're essential workers or not, was extremely, extremely important. Knowing too that the county had developed a campaign called Stay Home, Save Lives, and that knowing that that messaging was not necessarily relevant or appropriate for many of our communities of color, that we needed something that would resonate, that was community driven, community informed, and community inspired. So this You Matter, Stronger Together collective brainchild definitely is something that we've been waiting for. And I just want to salute Athena, Tammy, and her staff for being able to put this together so quickly. If you've ever worked on a marketing or communications campaign, you know that these things take time. And the fact that the initial meeting for this was at the beginning of April, and now we're at the end of May, and we have this movement. Again, it's not just PSAs or anything like that, but a movement to really show people in our community that we matter, that we're valued, and that, you know, the message of just staying home is just not enough for us. We need to be able to realize that we have a place in this community, that we have a voice in this community, and that we're more than just what people may see or stereotypes that they may have about us. So just overcoming those. So just again, how we're seeing COVID-19 manifest throughout the country, that Milwaukee was one of the first in the nation to look at the impact of COVID-19 by race and ethnicity, and that we helped other communities share their information too. So we were able to see that there's this trend of how structural and other forms of racism are playing out in COVID-19 incidence and prevalence. So even where we're at right now, as of yesterday, there's 5,395 cases in the city of Milwaukee. And now the Latinx or Hispanic numbers have exceeded the African American. There's about 1,947, and the African American is 1,904. So there definitely needs to be some extreme outreach and initiatives. And this campaign is definitely, this movement is definitely right on time. So everyone that's been involved, our Office of Violence Prevention, Lillian Payne, my Chief of Staff, the Mayor's Office, various alders that have reached out to say, how could we help? What do you need? The Greater Milwaukee Foundation, a number of the healthcare providers in the area, and then just everybody that has been actively involved in this initiative. You know, we appreciate your efforts. We needed you. So thanks for heeding the call, and we will continue to support this along the way. Thank you.
Thank you so much, Nancy and Dr. Kowalik, for your remarks. Now let's get to today's discussion. And so joining me on the panel are Laura Gutierrez, Executive Director of the United Community Center, Reggie Moore, Director of the Office of Violence Prevention with the Milwaukee Health Department, Dr. Monique Liston, Chief Strategist and Joyful Militant at Ubuntu Research and Evaluation, and Karen Olivia, Marketing and Communications Manager at 16th Street Health Centers. And so thank you all for joining the panel today. I want to lead and start off with the first question by asking, as you know, the You Matter campaign is focused on helping communities of color during these uncertain times. Please share why you support this campaign and what you hope it accomplishes. And so, Lauda, I'll start with you.
Thank you, Anita, and I want to thank the mayor, Dr. Kowalik, and everybody on the panel for these efforts. It's very important to come together in these challenging times. Indeed, we are all in this together, and the health of all of our community members of our wonderful city is very important. This campaign will help create a unified effort and vision for everyone to remain healthy while sharing culturally relevant information with those that really need it. Cuídate really is the essence of what we want to share with our Hispanic community. They do matter, we matter, and we need them to care for themselves, be safe, and protect themselves and one another, family members, cousins, extended family, because they rely on each other. The United Community Center family is very proud to be a part of this critical and important effort to raise awareness across the city about the precautions everyone can take to protect themselves and their family. We are thankful to join with the Stronger Together Coalition and happy to link our efforts together. We are appreciative of the investment being made by the Greater Milwaukee Foundation and all other players at the table. So thank you. I hope that kind of answers the importance of this campaign.
Of course, of course. And Reggie, I'll go to you next. Why is this campaign important to you? And from your perspective, why are you supporting You Matter?
I mean, when you think about the importance of trust, and trust is in terms of receiving messaging from people that that reflect your experience, your background, is critically important. Oftentimes we hear about a lot of negative data about our community or about the health disparities in our community, how many cases or how many deaths. It's important that, as Dr. Kowalik mentioned, that we build a movement that is affirming and that's life affirming, and that really speaks to how do we take care of each other? Because we don't just matter today, we matter every day. And our communities, unfortunately, get communicated a message that they don't. And so we know that COVID has hit our community hard, and the disparities that it has exacerbated, and the fact that we've pulled in creatives and really looking at how do we communicate messaging in a way that reflects the culture, the experiences, and the hope that is both in the Black and Latino community, and doing that together is critically important. And that crosses any kind of messaging, whether we're talking violence prevention, health or disease prevention. It's critically important to have credible messaging and credible messengers.
Thank you. And Karen, what about you?
Hi, we are really excited to be part of this campaign. Many of us have been working in the COVID space from the beginning, putting out messages, doing amazing work. When we saw the opportunity to come together, strategize together, leverage our resources together, and produce a unified message for our community, we were instantly on board. We all want the same result. We all want what's best for Milwaukee, and working together across communities with intentional messages and strategies is how we can make a greater impact.
And Dr. Liston?
I am excited to be a part of this because I think it's an opportunity for us to actually support a campaign that centers the livelihood of people of color. We know that institutionally, we're dealing with systems that have historically been racist, and we know that racism is a public health issue. So if we don't come into this space thinking about what does it look like for us to consider the healthy livelihoods of people of color first and see how those systems can make room for them and their livelihoods, then we're not having a campaign that's helpful. So I'm really, really encouraged by putting at the center people of color and their well-being, and not being an afterthought, not being blamed, not being secondary, but being at the center of what it means to be healthy and thriving and living our best lives.
Thank you so much. I couldn't have said it better. And so speaking again of those structural racism and the systemic racism, I want to hear from each of you guys about how do you think we can best address these health issues that have been a result of, unfortunately, the pandemic, as well as some of these systemic problems as well. And so Reggie, I'll start with you.
I think, I'll use violence prevention as an example. And when we, in 2016, expanded the work of this office, the first idea was we need to go to the community to determine what the priorities and solutions to this issue are, and particularly the community that's been impacted or communities that have been impacted the most. And so I think that applies, here as well. When we look at the history of this city and this country, the disparities, the racism, all of these things have been with us. When you look at mass incarceration, when you look at concentrated unemployment and poverty, it is not surprising that those same neighborhoods and those same communities would have or be at greater risk in terms of pre-existing conditions for COVID. And so I think what this opportunity, as far as this pandemic and also with this campaign, is again, not only to promote health and safety to survive this pandemic, but also really looking at the pre-existing conditions in our neighborhoods and how do we address some of the structural and systemic factors that have driven the inequity, that have increased the risk, whether we're talking COVID, whether we're talking violence, whether we're talking mass incarceration. All of these things are interconnected. And so the more that we can work across communities and across diversity is critically important, because I think isolation kills us, both literally and figuratively. And so the more that we can be united and strategic and also unapologetic about questioning the things that are driving, whether it be policies or other factors that are driving the risk factors in our community, we have to be committed to doing that. And we have to stay committed to doing that over the long term.
Thank you so much. And Dr. Liston.
I think what's important with understanding the structural components of this are understanding the ways in which communities of color have been positioned when it comes to health equity in our community. We know for a fact that communities of color have not gotten the health access and the health treatment that they have asked for and have needed, right? And so on one hand, this campaign is an opportunity for us to engage and look at our communities and understand and identify priorities and measures of success based on what we need. What also comes to task is when we talk about systems of accountability and what it means to take the structure to task, we cannot ignore the way white supremacy and whiteness has crafted the system that we're in. And so we have to be at the forefront of not ignoring what anti-Blackness is, not ignoring what anti-immigration policy is, not ignoring the impact of those realities into our everyday lives. And so I think while this campaign is really an opportunity for us to challenge, what does it mean for us to define success on our terms? It is an opportunity to speak truth to power. These systems have not made room for us, and we have to make sure that those systems understand that and are held accountable to that.
Thank you, thank you. And Karen, please share a little bit about your perspective on this.
Yeah, in addition to all that's been said, we have to work together to reduce stigma, remove social barriers. We really want to urge everyone to get tested and consider all you can do to minimize risk and spread. Getting tested for COVID is not something to be ashamed of, but it's the most responsible thing that you can do at the moment. You know, it's something to take ownership of. And we want people to not only do this for themselves, but for their family, for their neighbors, for their coworkers. So yeah.
And then I'll end it with Laura. Go ahead and share with us your perspective on this.
Yeah, thank you. So, the reality is that our families are obviously facing lots of challenges. The two zip codes that we serve, which are predominantly Hispanic, the 53204 and the 53215, as you heard Commissioner Kowalik say, they're being the hardest hit right now. And it is due to the fact that our families are the essential workers. They're going out to provide for their families. And so for us, the important thing here at the United Community Center is how do we continue to come together with people such as an organization such as the ones we are today to really educate our families and let them know the strategic things they need to do, not only for themselves, but for their families so that everybody is healthy. We know they're going to have to continue to work. We know that we have large families. I have 4 children myself. And so it's how do we continue to go about our day-to-day tasks to ensure that our families are taken care of, but that we are doing it in a safe manner and that we're practicing that. So the continued messaging in Spanish, if necessary, for our families, understanding that This is going to continue to keep them healthy, their neighbors healthy, and their family members healthy, and the proper information and the continual education of this is critical in our community.
Thank you so much. And before the panelists get to their next question, I want to take this time to ask those of you watching and listening to go ahead and comment, share this with your audience, and make sure this gets the reach that it needs, because this is a campaign and a movement, like we said, a movement that is really going to help build the communities of color in Milwaukee. And so comment down below some of the things that you're learning and key takeaways. And I'll actually take this moment to read a couple of questions or comments that I've seen so far. And so I see one here that says, this is from Annette Stokes, and she said, testing will allow you to know that you have the ability to infect others. And so that's a good point. Thank you, Annette, for sharing that. We also had another comment or question here that says, what is the value of being tested if there are no symptoms and unknown exposure? And so we'll get to answering those questions later, but keep the comments rolling and keep sharing this. We love to see you guys engaging with us. So I have one final question for the panel. You all clearly do work that forces you to deal with the painful realities that Black and Brown people face daily. What gives you hope, and what personal message would you like to share that supports the Stronger Together collective's goal of instilling hope and advocacy? And so Dr. Liston, I'll start with you.
I think that hope is really at the center of all of this. When you make a declarative statement such as I matter, my livelihood matters, my existence matters, you have to go into it with a sense of hope. That this moment that we're experiencing is not going to be, is temporary, that we are going to get past this and things will look different. I think what also brings me hope is this whole situation with the pandemic has forced us to reckon with ourselves in new ways. We have had to look at the ways in which we were operating, whether it was professionally or personally, that it was doing more harm to us than good. And so with this forced opportunity to slow down, reconsider, engage differently, I think we have the hope of thinking, okay, we can move about this differently. I can create better and stronger relationships within my community. I can speak out about things that have happened to me in terms of injustice or inequity, and I will be supported. And that we have the ability to collectively address how these institutions of power need to change. And whether that is our hospital system, whether that's our health policy, whether that is just the everyday interactions you're having with people in your community, this is the time where we can align ourselves together and make sure that we can address those issues and not allow them to continue to fester, continue to let inequity exist, continue to let our lives matter less than other lives in this city.
Thank you. And I'll go ahead, Reggie.
I was saying Ashe.
Anything else you'd like to add to that?
No, I just want to echo the fact that as a people, all of many of our communities, Indigenous, Latinx, African American in this country, have survived a lot. And when we look at what we've lost even during this pandemic, elders, leaders, ministers, businesses, jobs, it's understandable why people may feel a sense of hopelessness. But we have always overcome. And we continue to overcome. And although there's, always repression and there's consistent oppression, that together we can overcome this, and we will. However, we have to, again, be united, both in our purpose and in our mission. Look out in terms of what we do to make sure we're looking out and take care of each other in terms of trying to prevent the spread of COVID. But then also, as Dr. Liston mentioned, we also have to stay united and be strong in addressing a lot of the disparities and inequities that have led to the disproportionate impact of COVID on our community. And we can only do that if we're healthy in every sense of the word, whether we're talking mental health, financial, spiritual, et cetera. So again, I think that this has been an enormous reset button and opportunity. But again, we can't just go back to normal because normal was already deficient for our community. We have to sprint ahead.
Thank you so much. And Karen, I'll end with you if you want to give a few remarks as well.
Yes, so a lot of us are, facing barriers, and there's a lot of things at play here. But I know I'm speaking for many when I say we are strong, we are providers, we're fighters, and we do everything we can to keep our family safe and healthy, and this is no different. So during this time, we have to be responsible and do what's best, not only for ourselves, but for our community.
Thank you. Thank you. And so I'm seeing the questions coming in, and this is so exciting. And thank you all for sharing your thoughts on this. And so I'll go ahead and read a few of the questions, and then I will ask one of our panelists if they could answer that. And so I'm seeing a lot of questions here about testing. And so I'll read a couple, and then I'll ask Dr. Kowalik if she would like to share her thoughts on that. So the one that I saw is, what is the value of being tested if there are no symptoms and no known exposure? Someone also asked, how are we supporting post-testing? If someone tests positive, what are next steps for them and their family? So I'll go ahead and open that up to you, Dr. Kowalik, if you would like to share your thoughts on that.
Yes, so I addressed some of this in the chat for those that can't see it though, but I'm saying that knowing your status is very important so you can take care of yourself first and foremost, right? There's no treatment, there's no vaccine, or there's no antiretroviral or anything like that at this point in time for COVID-19. So we have to go back to square one. What are some things we could do to take care of ourselves? So just making sure we're getting adequate rest. There's federal laws in place or supports in place for people to get 2 weeks of sick time, depending on their job, so that they can at least have some type of income while they're out taking care of themselves. Also, making sure you're not exposing other people in your house or just in the community. If you are positive for COVID, knowing that once you're positive and your symptoms are gone, you can still shed or spread the virus for up to 5 weeks after, and some people have been even longer than that. So it's really important to know what's going on with your own immune system and to take care of it. I mean, there's a lot of natural things. I know a lot of people are fans of the late Dr. Sebi and others, things you can do to reduce mucus and really boost your immune system naturally. But we know that the weathering of racism, this whole notion of being perfect to be accepted, how we're disrespecting our bodies, our temples by doing this. So we really need to reevaluate how we function as a people of color. That why are we sacrificing or killing ourselves to somewhat be accepted? So, I want us to be looking at that at this point in time, but keep revisiting that notion on a weekly basis of what are you doing that's disrespecting yourself, your immune system, and working on unpacking that and what can you do to get to a better place. I'm doing that personally. So, I encourage you all to start doing the same thing. But unfortunately, I got to go. I got to be on WNOV right now. So I'm going to do my daily update, but I'll pop back in.
Thank you so much, Dr. Kowalik. Thank you, thank you, thank you. And so you also mentioned, and Dr. Kowalik mentioned that it also is about personal care as well. And so Dr. Liston, I want you to touch on that a little bit, because You Matter is about a holistic well-being, right? It's physical, mental, and emotional. And so talk about why a holistic health is important.
Yes, I so appreciate that. And I just want to echo Commissioner Kowalik's sentiments about how important it is to take care of ourselves. Rest is important, eating right is important, making sure everyone who knows me on social media, you drink your water is important in this time. I think that we are often missing the components of how talking about racism as a public health issue is an opportunity for us to see all of the intersecting ways in which living in a racialized society impacts our health, right? And so as a Black woman, I can speak to the ways that my body is physically enduring stress because I'm engaging whiteness and white supremacy in so many different ways each day. And some of us, we're not as conscious of it because we've just always been doing it. And then we recognize that 10, 20 years later, our whole system has been beat down. We're not able to recover as quickly. We're out longer when we catch a cold. We're not able to digest like we normally should. So I think if we understand that just living in this society is a challenge to our health, That means that we need to go above and beyond what is suggested to take care of ourselves, okay? And that means we need to call each other and remind each other to rest. I know Reggie can testify to how many times I'm checking on him, like, did you rest, brother? Have you taken, have you eaten something? Have you drank your water? Like, are we making space for us to uplift our community, not in a sense of reaction, but in a sense of care? Right? What does it mean for us to matter so greatly, right, that we are going above and beyond to make sure that we're all right? And so I think acknowledging that within this campaign makes room for us to think about ourselves differently, to care about ourselves differently, to provide different resources that allow us to acknowledge what is culturally important to us, that puts us in a position to care for our families and care for others in deep and resonant ways. So I am an advocate, wear our masks, y'all, drink plenty of water, y'all, take your vitamin C, go outside and get some of that sunlight when it comes, and take care of yourselves, because just like we said before, we cannot fight this fight if everyone's sick. So we have to take care of ourselves first so that we can address the larger issues at hand that are also contributing to other people getting sick.
Ooh, thank you, Dr. Liston, for really nailing that on the head. And that is the whole thing about this You Matter campaign. It's when you matter, your health matters, your family matters, everything around you matters once you make yourself a priority first. And so, Karen, I want you to touch a little bit about what the importance of family, and specifically within the Hispanic community, and why it was important to include that messaging and those images as part of this campaign.
Yeah, so family, especially in the Latino community, is central to who we are. So how do I say this? There's, a lot of families, including myself, that live in multi-family homes. And a lot of times you don't have the space to quarantine yourself if you're feeling slightly sick. So it is important to follow those steps that are being provided to take care of yourself, to not only protect yourself, but to protect the people in your household. So for us, it was very important to address family yeah.
Thank you, Karen. And Reggie, I want to specifically ask you, it's unfortunate that, most recently, again, the killing and attacks of Black men and women. And as a Black man in Milwaukee, I want you to talk about your experience and exactly what you're doing as a Black man in Milwaukee to take care of yourself and to affirm yourself and to know that you matter.
That's an ongoing work in progress. As my sister, Dr. Liston said, it's important that we check on each other. I have a network of men in the community that we do that with each other. When you see Black bodies dying, whether it be to systemic violence or to interpersonal violence or family violence in the community on a daily basis, that takes a toll on a person's mental health, on their emotional health, and even your physical health over time. And so, I try to work out, ride my bike, do things to try to, meditate, pray, to maintain both my sanity and balance. And also, putting family and keeping family first, knowing and being unapologetic about saying no. I can't, do that right now, or I can't respond to that right now at 1 a.m. or at 2 a.m. And again, balancing that self-care is important. And I also want to just take a quick moment and just, because again, I think this has impacted both men and women of color, is just to say the names of Joel Acevedo, Ahmaud Arbery, George Floyd, as well as Breonna Taylor. And so when we think about the lives that have been tragically lost, even during this pandemic, to structural and systemic violence and racism, these are things that have take a toll on a person's hope. And it's compounded trauma, right? Where you're dealing with a pandemic and you're also dealing with the daily trauma of life. And so the more that we can rely and lean on each other and see images and be in relationship with each other, I think that inspires both hope, healing, and determination to keep moving forward.
Thank you. And at this time, I'm also going to tune back into the participants. I see a lot of questions and comments coming in, so keep them rolling, you guys. This is awesome. And I think this discussion is so needed in our community. And so I see one question here that is asking, how can we message differently in communities of color to encourage us to wear masks and practice social distancing while in public spaces to reduce the infection rate? And so I will give this to Reggie, and I want to start with you, and go ahead and answer that for us. And so the question was, how can we message differently in communities of color to encourage us to wear masks and practice social distancing while in public spaces to reduce the infection rate?
Right. I think the critical piece of that is not coming at it from a punitive and sort of from an enforcement perspective. What has worked for Forum for Life and community activists and other groups like Team Havoc who've done outreach, who passed out masks, even when you look at the mutual aid groups, it really is about education. It's about love. And that the messaging is not starting from a place of you've done something wrong, but that we want to see you healthy and alive. And so I think coming at it from that perspective makes a person more amenable to receiving that message and thinking about, and most importantly, if you can provide them with a mask in that moment, that's extremely helpful, or at least direct them to where they can get one for free. Because access, as I think many people have mentioned on this panel, is critically important. And then starting with a message of love is what I think is most effective.
Thank you. Thank you so much. So right now, as we end our community conversation, I really want to thank you all for joining us today. We are excited to have you be a part of this conversation and for launching this You Matter campaign and movement in Milwaukee. And so before we leave, I would like to ask the panelists if they have any last and final comments that they would like to share, or key takeaways that they would like to share with the audience. And so I'll start with you, Dr. Liston.
Yes, thank you so much for moderating this conversation, Anita. I so appreciate it. I think it's important that we really lift up young people in this situation. The pandemic is not a normal circumstance. It is a challenging circumstance for us to be in. And so we have to acknowledge that young people, especially with schools being closed and summer coming, have a unique position in terms of understanding their needs in this moment. And so listening to youth needs and creating spaces in which they can be safe, I think is super important when we talk about our messaging. And then I also want to acknowledge that I lost my grandmother during the pandemic, and then a lot of us have had to deal with grief during the pandemic. And when it comes to communities of color, our grieving often means that we are together. And because we're in the middle of a pandemic and we're not able to process our grief as we have in normal circumstances, that means we're also like having this compounded sense of grief that's happening. A loss of our day-to-day normal lives, a loss of our loved ones, an ongoing reminder of the constant state of fear and inequity and white supremacy that we live under that has been compounded in this moment. So when we talk about You Matter and making room for us to care for ourselves, I'm asking and pleading for folks to like do this in radical ways that you've never even thought about before, because it's important for us to do that now. This circumstance, this moment is not normal. It's not okay. It is challenging. And we really, really need you, your family members, to see you get through this. And so I really want you to invest, reach out, ask questions of what else you could be doing to be safe with you and your family, because these resources are here. We need to get them in the hands of our communities and make sure that you, yourself, all young people connected to you are safe and protected during this.
Well said. Thank you. Thank you so much. Reggie, I'll give it to you. Last final questions or comments? Reggie, I'll give it to you. Any last final questions or comments?
I'm sorry, I was muted. I just want to express gratitude to Tammy, to you, to Biko, to everybody that's been involved on the creative end of this. And then and I'm sorry for earlier, I was responding to some of the Facebook comments. And because many of the people that I see commenting are people that I deeply respect and work with. And I just want to affirm that this is the starting line. Like, this is the launch of the campaign, but there is space for everybody in terms of organizations and groups. And we want this to be a model of how we message and outreach and prioritize particular communities. And this is just the beginning. And so I want to invite people to, again, plug in, reach out to Tammy, myself, anybody on this panel. But again, this was just an opportunity to launch the campaign, to make it public. But there's been a lot of work behind the scenes of bringing it to this point. And I just want to affirm everybody who have committed their time and energy to getting us this far. So thank you.
Thank you, thank you, thank you for saying that, because yes, this You Matter campaign is definitely just the beginning, everyone. Please be aware that we are, through this campaign and through this movement, we hope to create a shift in how we are telling the stories and how we are affirming people of color in Milwaukee. And so, Karen, I'd like you to leave us with the final words and share with us your thoughts on everything.
We are very thankful to be a part of this campaign, to work alongside with our community partners and organizations. It's important to come together now more than ever to create a unified message that resonates, and there's, action. We just want to remind everyone that here at 16th Street, we are here for you. We have 2 testing sites, one in Chavez, one over at our Parkway Clinic, and in Waukesha as well. We test Monday through Friday, and we're here. You can find more information on getting tested on our website, and it's very quick and simple to do. So, yeah.
Thank you, thank you, thank you to our panelists. Thank you for all who've joined. And I'll leave you with one piece of information that Dr. Kowalik shared with us, and that is that the health department has been providing housing, food, and basic needs for those in need. We've been using 211 to link folks to services. And so anyone that's tested positive for COVID in the city of Milwaukee is connected to their nurses and contact tracers who also ask about their needs and figure out ways to work with them. And so that is a resource that is available for you all. If you have any other questions or comments, continue leaving them in the chat. We will be going through all of those, and we really want more people to join this You Matter campaign. It really isn't about one individual organization. It is about the collective. It's about building unity and partnerships so that we can get through this unprecedented times together. And so with that, I'd like to thank everybody who was a part of putting this together. There were many hands behind the scenes, literally, who helped create this. And so I want to send a big shout out to those individuals. And of course, make sure to follow us on our social media channels on Facebook, Instagram, and Twitter. And that is at You Matter MKE. Continue to engage in the conversation, and we hope to connect with you all in future community conversations that we are planning to host. And yeah, we will see you later, and look out for a survey that will also be linked to this chat and also to the event page. So with that being said, thank you everyone. Thank you for joining us this morning, and have a great rest of your day.